All right, folks, so the data that I've been talking about is finally in. This is super exciting stuff. Stick around. I'm going to try to go through this the best that I can to present something I think is incredibly powerful, incredibly earth-shaking in the world of health, quite honestly, and cardiovascular disease. And so last night, Professor Matt Budoff from the Lundquist Institute at UCLA presented a collection of data which will soon be published in Metabolism, the journal. The abstract will be published there very shortly. And what he looked at were a collection of people on very low-carb ketogenic diets that happen to have extremely high LDL cholesterol. We're talking as high as 600 milligrams per deciliter, just off the chart, super high. And what they did was they did something called a coronary CT angiogram. So they looked at very high level, very precise, very sensitive study looking at the coronary vessels in the heart. And they looked to find out how much plaque was in the heart of these people with this super high cholesterol. And they compared it to age-matched controls that were identical essentially in every other way. They had the same level of body mass index was almost identical. The ages were almost identical. Average age of about 55. They all were healthy. None of them had diabetes. None of them had hypertension. So they were identical effectively in every single way, except the one difference being is one group had super high, ridiculously high LDL cholesterol versus one that had normal LDL cholesterol. Okay, and the average person that had the high cholesterol had it at least that high for at least 5 years, right? And Matthew Budoff, the principal investigator, is arguably the world's leading authority on how rapidly you can detect plaque accumulation in the coronary vessels over time. And 5 years is plenty of time to see this, right? So the prediction should be, based on the current understanding or beliefs around cholesterol and heart disease, is the group that has the highest cholesterol over time should definitely have more plaques in their arteries. That is what we would expect, right? What did they find? So what did they find? So this is a slide from his presentation. It shows that the two groups here, the one on the left is a group that had the super high cholesterol, and the one on the right is the group that had the normal cholesterol. And guess what? There was no difference statistically between the two groups. It did not matter if you had super high cholesterol, as high as 600 milligrams per deciliter, versus somebody that has a normal LDL cholesterol, right? In fact, even though there was no statistical difference, the trend was that the people with the high cholesterol had less plaque in their arteries, right? So what does this mean? Does it mean that you can ignore LDL cholesterol and it doesn't matter? No, it doesn't mean that. And Dr. Budoff, in his 17-minute presentation, says that no, you cannot ignore that. He's still a believer in LDL cholesterol being causal to cardiovascular disease. But what he is saying is that it appears to be, in some instances, this particular set of population, low carb, lean, otherwise metabolically healthy, that it appears that cardiovascular disease is not developing, or not developing at any significant rate at all. So that may give some of you guys that are in this situation some level of relief. His suggestion was, if you have high cholesterol but all the other markers look good, get sort of an imaging study, maybe get a coronary calcium score, and if it is low or zero, then you're probably pretty good. I think that's probably where it is. So to me, as I've been saying all along, it means that LDL cholesterol, while potentially causal for cardiovascular disease, becomes a dependent variable. It depends what else is going on, right? And so this is big, this is huge. The study is going to continue on probably for several years. They're going to get 1 year data to see if any progression has occurred. And if they still do not see progression, even though they've already had 5 years of a collection period, more or less, then it is likely that we can start to say that, hey, LDL cholesterol, and by extension ApoB, because ApoB is part of LDL, LDL is part of the ApoB subset, basically, that we have to rethink the entire nature of LDL is always, or ApoB is always cause of cardiovascular disease, because clearly in this population, which has never been studied before, particularly in this level of detail, it appears to not be so. All right, guys. Tomorrow at 10 a.m. Pacific time, I'm going to be hosting both Dr. Nick Norwitz and David Feldman to discuss this in detail in a much longer format. But this is the overview. I hope you guys appreciate it. I think there's more to come on this. More research needs to be done. There's more questions that need to be asked. Can you expand this to everybody and say LDL cholesterol doesn't matter to anybody? No, you cannot say that. But, we're starting to see some significant questions that need to be asked. All right, guys, thanks a bunch. Let me know what you think. Let me know if this has been your experience too. I see a lot of people saying, hey, I'm carnivore, I'm keto, my cholesterol's through the roof, but my CAC score is 0. I've got no evidence of heart disease. Let me know if that's been your case in the comments below. All right, we'll talk to you soon.
Yeah. These are the baseline characteristics, and there were differences, most notably, of course, in LDL cholesterol. 272 average LDL in the keto group. Miami Heart group had an LDL of 123. All the other variables were well matched, as best we could match these two different populations. So when we looked at these population, they were both 55 years old. Again, the lean mass hyperresponders had an LDL of 272 milligrams per deciliter on an average of 4.7 years duration. So it wasn't like this was 1 week of having LDL this high. This was almost a 5-year duration of having a ketogenic diet and an LDL above 190 milligrams per deciliter. When we compared them to patients with more normal LDLs, mean LDL of 123, there was no difference in coronary plaque burden. So we did not see any evidence that this LDL of 272 induced more atherosclerosis over this 5-year period.